Assalamu alaikum. In this video, I will teach you about urinary bladder by using this hand. Consider this as a urinary bladder. Now, these are the two ureters that enter into the urinary bladder. Remember that these ureter enter into the urinary bladder. They are obliquely present, and anterior to that, the vas deferens runs in case of men. Right now, if that we commonly called as water under bridge, because vas deferens runs below the ureter, anterior and above the ureter, and the ureter, as we know, contains urine, so we call it as water under bridge. Now, and if there is any infection in urinary bladder, so the urine or infection can enter into the ureter if the ureter does not enter into the urinary bladder obliquely. So that will be called as ureteric reflex, right? And now let's talk about the surfaces of the urinary bladder. Now this one is the above one. This is called the superior surface. Consider my thumb as the anterior border. These two from these both sides, right? This one and this one. These are the inferior lateral surfaces. And normally in anatomy we call the space that is present posteriorly as posterior substance or area or dorsal. But here we call its posterior surface as base, right? This one is the base of the urinary bladder. Now as we know in case of male, behind in the base region there is presence of two vas deferens, and lateral to these vas deferens there is running of the seminal vesicle, and the vas deferens and the seminal vesicle both combine to form the ejaculatory duct, and this ejaculatory duct opens into the prosthetic urethra, right? Now if we talk about this anterior border which ends here, from here there is a median umbilical ligament which runs, and that is attached with the umbilicus. This median umbilical ligament is the remnant of urachus, or you can say allantois, right? Now if we talk about the urinary bladder, about the superior surface. Now in case of female, the uterus, which is pea-sized, is placed on the superior surface of the urinary bladder like this, right? And when the urinary bladder is filled, this will move up, so as a result the uterus will move also upward. Now normally in normal condition, when urinary bladder is empty, the ureter is present on the superior surface, present horizontally, right? Now if you consider, now I want to say, now if I told you about the base structures related to the base of urinary bladder in case of male, that was vas deferens, and lateral to that there is presence of seminal vesicle. Now in case of female, vagina and cervix are in relation to the base. As I told you that uterus is present horizontally on the superior surface of the urinary bladder, and below that, as we know, there is cervix and followed by the vagina. That's why. Now if I open the urinary bladder, you will observe a trigone space. That is the space is shiny smooth space, and there is no presence of rugae. It is a triangular space, and there's mucosa is adherent to the muscularis externa. There is no submucosa in the trigone. Now there are two disorders related with the commonly and that we study in anatomy related to urinary bladder. One is neurogenic bladder. Neurogenic disorders are these. One is autonomous bladder and one is autonomic bladder. Okay, I will teach you in the next video about that. If I talk about the blood supply of the urinary bladder, one is superior vesicular artery and inferior vesicular artery, and the inferior vesicular artery is absent in case of female. It is only present in male. Remember this. Okay, if I talk about the ligaments, I told you about the one ligament, that is median umbilical ligament, that is attached with the umbilicus, and it is a remnant of allantois, right? And now if I talk about the two more ligaments, one is posterior ligament and second one is lateral ligament, and both these ligaments are attached from the inferior lateral surface of urinary bladder to the pelvic wall, right? Because as we know, laterally there is presence of pelvic wall, and they both are attached with the pelvic wall. About the importance about the posterior ligament, the vesico-venous plexus run in that, which is responsible for venous drainage of urinary bladder, right? As I told you that in female the uterus is in relation with the urinary bladder on the superior surface, but in case of female the peritoneum runs on the superior surface, and then posteriorly there is presence of rectum. In case of male, directly, because uterus is absent in male, as we know, right? So the peritoneum runs here above the superior surface of urinary bladder, and then it runs towards the rectum. So there is presence of a pouch that is called rectovesicular pouch, also known as pouch of Douglas. And the importance of this pouch is that in case of female, when the person is in erect position, so it is the most dependent position where fluid will be accumulated. That is pouch of Douglas, or we can say that the pouch is called rectovesicular pouch. In case of female, since the urinary bladder is there and the peritoneum covers the small amount of superior surface of urinary bladder, then runs upward to this ureter that is present like this, right? So the peritoneum will come there and it is move upward to the uterus. So there will be a small pouch formed that is called you can say utrovesicular pouch, since there it is present between the uterus and urinary bladder, and it is also in case of female most dependent space. No, sorry, in case of female the most dependent space will be recto-uterine pouch. This pouch that will be present between the uterus and the rectum. Sorry for my mistake. And it's all about urinary bladder. Hope you like the video. So don't forget to subscribe.